How long did it take for you to express your swelling the first time?
Well, I had the surgery in December of 1996, and I believe it was in March that I went to the airport to pick up a relative, and I reached down and picked up her suitcase off the turnstile with my left arm,
Gotcha.
which was the one I just had surgery on.
Right.
And I believe it was the very next day my hand was swollen.
Okay. Did you notice that you had strained yourself in any way?
No.
Okay.
I didn't know anything. My cousin had lymphedema in her leg, so she recognized it right away.
So that is a very kind of classic clinical picture where lymphedema, we know that there are three main triggers for it. Small injury of some kind, a small trauma. It might be walking your dog and you've got the leash wrapped around and the dog yanks your shoulder, and that's just a small trauma, but that's the trigger. Lifting something heavy. It might be an infection. It might be weight gain, believe it or not. Those are the three main triggers. So if you had a body type that you tended to be a little overweight and then you got lymphedema and you got even, or rather you had your cancer therapy and you got even more overweight, maybe it's even from chemo drugs that you're taking, that can be a trigger as well. So weight gain. So what did you do as your first kind of line of defense against your swollen hand? Did you go directly to your general practitioner?
I made an appointment with my doctor, but I went right into a facility that sold the gloves to suppress the swelling. My cousin again told me this is what I should do, and so that's what I did. And then when I did go to the doctor, he knew of a place that took care of lymphedema, and I went there for my treatment.
And weren't you lucky?
Yes, I was very lucky.
So most people in your situation would not have been directed to appropriate lymphedema resources.
That is correct.
So let's figure out if they were appropriate. Did you go to a place that did manual lymph drainage, the massage component?
That's exactly where I went.
And they did compression bandaging, they wrapped your limb, and they weren't using ACE bandages that are very stretchy, right?
No.
They probably took care of your skin with lotions and creams. Did you get some exercises that you needed to perform?
Yes.
Okay, so that system is complete decongestive therapy, and that is the gold standard system. So you truly were kind of networked into the right medical practitioner, whereas many, many people would not. Even today in 2015, there's a lot of neglect, and people don't know what the appropriate medical pathway is for lymphedema. It is changing, but you know, way back when you had your first bout, to be networked into someone who knew complete decongestive therapy and has obviously kept you on track is pretty remarkable.